let's welcome Ms. Jayatri Mandal, Senior Oncologist from 4Base Care. She will be talking about the importance of maintaining good mental health and good quality of life during and post-cancer treatment. It's a pleasure for me today to introduce you to Jayatri. She is associated with 4Base Care since February 2022. She has completed her MSc in Health Psychology and MPhil in Psycho-Oncology and provided around 1,000 onco-psychological consultation for patients and 4Base Care till date. Over to you, Jayatri.
Thank you, Aditi, for this amazing presentation. And good evening, everyone. My name is Jayatri. I am the Senior Psycho-Oncologist from 4Base Care, Bengaluru. And I help to deal with emotional, behavioral, and social concerns related to cancer care for both patient and their caregivers. Before starting with today's discussion, we will be now presenting a small PowerPoint to briefly explain about what is psycho-oncology and how it really can be beneficial for the cancer community. Before starting with today's discussion, let's talk about a myth that is really very common in our society. That is, until and unless I am not psychologically or mentally absolutely disturbed or distorted, there is no need for me to consult any psychologist or even therapist. So now, today, in today's webinar, we all are present here, and we all know that in cancer population, none of you or the caregivers, they are psychopathologically ill or psychologically not in a right state. So now the question comes why we need to visit a psycho-oncologist, because cancer treatment really takes a long time, and during this time, patient can feel depressed and anxious, and sometimes they may develop post-traumatic stress disorder as well. So it's very important to find out the reason why patient feel distressed during the cancer treatment and how psycho-oncology services can be extremely beneficial for you. The first thought that comes into the mind during the treatment for any cancer patient, that is, why me cognition, in the sense, why the cancer has happened with me, because always I have lived a very healthy lifestyle. My eating pattern was very good, or neither I have done any sin. So now why? The another symptoms that patients start experiencing, that is sleeplessness, and particularly at night. We have seen during the counseling session that patient can sleep properly during the daytime, particularly in the afternoon and the evening, but the problem comes to sleep at night. They start experiencing multiple anger and irritability issues, lack of interest, even stepping out from the home as well. They always try to stuck themselves into a small room and maximum bedroom, do not like to talk to other people as well. So other pain and biopsychosocial discomfort also they start experiencing, and body image issues. As we all know that during the chemotherapy, patient may start losing their hair, their skin color and the nail color starts changing. And also there are multiple surgical procedure as well. For example, MRM, that is the modified radical mastectomy, and probably head neck cancer as well, when they need to put a Ryle's tube. During this, and the structure is changing rapidly, and it's not so easy for any patient or the caregivers to accept them the way they look now. These body image changes can really create multiple types of or multiple severity level of stress and anxiety within the patient. So it's very important that please consult to your therapist or your psychologist for a better quality of life. Now, in the next slide, we will be talking about other psychosocial concerns that may affect the cancer patient really badly. Another concern that comes in this time, that is fear of cancer relapse. We all know that patients start feeling that if my cancer relapses once again, multiple negative thoughts. For example, I'm spending so much money, I'm spending so much time and energy. Even after that, if my cancer treatment or the medication doesn't affect within my body at all, then what's the purpose of doing all this treatment? Patients start experiencing decreased self-esteem and self-confidence. Cancer-related is mostly common during this time, and also decreased physical functioning, reduced role and aspirations in life or career. We have seen it particularly within the survivors. Before their cancer diagnosis, anyone may feel that I would like to be a teacher, probably I would like to be a businessman. But after the cancer treatment or during the treatment, they may find that probably I am not at all potential in doing anything. They start experiencing severe behavioral, emotional, and social deficit, majorly fear, anxiety, and distress, and they may start feel that probably I'm a burden to my family members, or probably at my workplace, everyone is talking about me and they are feeling that probably I am taking advantage. unnecessarily because my cancer treatment is going on. As a result, we have seen that patients sometimes may start neglecting their treatment, they may deny their treatment, and also sometimes they may deny their diagnosis as well. So understand here, if because of the psychological distress, patients start denying their treatment and even diagnosis, definitely the prognosis is not going to be good. As a result, the entire well-being and quality of life can be deteriorated within no time. That's the reason it's very important that please to consult with your psycho-oncologist or therapist for a better quality of life, not only for the cancer patients, but also for the caregivers as well. Now, in the next slide, we will be talking about how objectively a psycho-oncologist is going to provide you the psychological counseling and what benefits you will be getting after that. Let's take one example before starting the discussion. If any patient who is a wife of a family is diagnosed with breast cancer, and for example, she is hospitalized now and undergoing the treatment, it's very obvious that the husband needs to take care of everything, including the household chores, managing the finance for the treatment, also his own job, also taking care of the children as well. As a result, there is also a probability that in the household, the dynamics between husband and wife may change, can be deteriorated as well. Not only that, in future, the relationship between the children and the parents can also deteriorate to a certain extent. So it's very important that if you want to manage a good family dynamics, not only for the patient, but also for the caregivers in the family during your cancer treatment, take recommendation or take a family counseling session from the psychologist who will be really very much helpful for you with certain suggestions and certain recommendations so that your family bonding within the spouse and within the children and the parents can be intact just like before. Now, let's look at the left side of the screen. Here you can see one scale. In this scale, you can see 0 to 1, which is below the screen. That is basically my patient's mood is fine. I'm very happy. But if you go on the top of the screen, you can see this is 8, 9, 10. It means my patient is not happy and my patient is crying. So this is the exact way how the psycho-oncologist works. If our patient is not happy, it means if they're upset or if they're experiencing any sort of distress, with the proper psychological therapy and intervention, we will try to put it down to the good mood, which means either 0, 1, or 2. As Dr. Sandeep Nayak has already explained about multiple stigma and multiple myths in our society regarding the cancer treatment, a psycho-oncologist exactly does the same thing. For example, if there is a myth that if you have a patient at your home who is now diagnosed with cancer, probably you cannot sleep beside that person, you cannot eat from the same plate, or probably you cannot use the same towel or the same washroom. So these are myths. During the psychological conversation, when a psychologist will get to know about it, they will provide you the right information that how you are supposed to take care of your patient and also your own health as well. During the cancer treatment, patient and their caregivers may start experiencing multiple types of anger because of multiple reasons and irritability issues as well. So there, a psycho-oncologist will objectively recommend you multiple strategies to manage your anger and your irritability for better coping so that your overall quality of life can be better as far as possible. In the next slide, we will be talking about multiple stress management techniques for your better well-being. It's very important for us to understand that we need to keep our mind calm for our better health. And for that, the stress management techniques come into picture. Total 2 types of stress management techniques we usually recommend in counseling session. One is cognitive stress management. Another one is behavioral stress management techniques for particularly cancer patients and their caregivers. As a psycho-oncologist, I really prefer mindfulness breathing. And if you have any friend or any well-wisher or even your therapist, try to open your heart out and try to talk to them. Try to release your emotions as much as possible to them through talking. If you feel that mindfulness meditation is really helpful for me, there are a few strategies that now we are going to talk about. First of all, you can do it at any point of time, either probably morning, afternoon, or at night before sleeping. Just close your eyes, make your body comfortable as much as possible, all the muscles. Just inhale from nose and breathe out from mouth, and make sure that during that time, your entire attention should be on your breathing pattern only. Try to make it maximum 3 to 5 minutes per day for each session. As we were talking about earlier, try to find out a friend or probably your colleague or probably any well-wisher to whom you can talk to. Because during the cancer treatment, the only conversation that usually we continue at our household, that is, when is your next follow-up? What all you need to eat from till morning till evening, and what medications you need to take today. But beyond that, every human has plethora of emotions, and it's very important that that also needs to be catheterized to anyone. What will happen after that? Your mood will be improved. Your anxiety is surely going to be reduced if you have a place to express all the emotions that you are experiencing currently. Your confidence level is also going to be increased. Also, your positive reactivity is also going to be increased. Now, in the next slide, we will be looking into the other cognitive stress management strategies that can be very much beneficial for all of you. For example, if you love painting or if you love drawing, that can be very much beneficial for you. And for that, just you need to take a white paper, some colors, and a pen. You can draw, you can paint, you can make a circle, whatever you like to do, just do that. Many of you may probably like to listen music or like to sing any song. It can be either contemporary or even spiritual music as well. Whatever you peace, whatever makes you happy, whatever can engage you throughout the day, try to do that. And let me tell you, for that, there is no need that you need to be an expert. It's all about catharsis, which means if anything we cannot express through words, we need a medium. And that medium should be either it can be my gardening, probably a walking, or probably playing with my children. It can be painting, drawing something. It can be even listening music as well. As a psycho-oncologist, what I personally recommend to everyone, that is try to read or write something. The question comes that what should I write and why should I write? You can write anything. Just take a diary. You can write your name, your date of birth, today's date, or probably your age, your address, and what all you had since morning till night, and probably next day. What do you like to do? The question comes that why should I do that? Because during chemotherapy or other modalities of cancer treatment, sometimes patients may experience mild forgetting, sometimes mild confusing state as well. If you write and read on a regular basis, you will understand that you are not confused to some greater extent, like you are able to hold your memory at the right point. The first few days, surely your handwriting is not going to be good. But if you compare your first day handwriting and 7th day handwriting, you yourself can understand that the difference. And that can be also one of the very important points where you yourself will be feeling more confident than before. If you want to read something, try to read newspaper. And if you feel that, no, I'm not so much comfortable and I'm getting headache or probably I'm getting backache, please ask one of your family member to read it for you and try to concentrate on the newspapers or probably any storybook as much as possible. Now, in the next slide, we will be talking about multiple cognitive distraction strategies that can be very much helpful during the course of treatment. Sorry, before going ahead with the distraction strategy, now we will be talking about the behavioral stress management strategies. So, regular walking is very much important. Try to walk at least 30 minutes per day. It can be 15 plus 15, probably 15 in the morning and 15 will be in the evening. Try to have a good quality of sleep, and that should be at least 8.5 hours. At night only, try to avoid sleeping more than 2.5 hours during the morning time. If you are active physically throughout the day, and also if you are engaging yourself into self-care activities and minimal household chores as well, you will be getting proper sleep at night. As a result, your mood will be improved, your physical energy will be increased as well, and also, as in the last slide, that the cancer-related fatigue and the stress also going to be reduced to a greater extent. Now, we will be talking about the multiple cognitive distraction strategies. Total 3 types of cognitive distraction strategies that we need to follow. The first one is basically the 5, 4, 3, 2, 1 technique. Let's focus on here. Try to acknowledge 5 different things that you can see through your eyes. Try to touch probably only 4 things that you can see. Now, probably in front of me, I have my laptop, my pencil box, my mobile phone, and my water bottle. So I need to focus on those 4 different things, and also try to listen 3 different sounds, try to smell 2 different sounds, and also try to taste any sort of thing, if that is in your house. For example, it can be salt, sugar, everything. Try to follow the 3-3-3 rule there. Try to look around and name 3 things that you can see. You can try to move 3 different parts of your body. Also try to name 3 sounds that you can hear. Also, let's focus on today, which is basically you need to focus on today, not for the future or not towards the past as well. Try to cherish each and every moment. Focus on what you are doing today, what you want to have today, what you are listening today, what all you would like to do probably within the next 1 week. If you feel that you are very much immunocompromised and you can't step out at home, try to play indoor games with your family members. It can be either chess, carom, or anything. Remember that it's all about the regularity and consistency. In the next slide, we will be talking how our caregivers can be very much helpful for the cancer patients for managing their quality of life. Try to reinforce and motivate your patient to do at least their self-care activities, for example, eating with their own hand, combing their own hair, or probably wearing clothes by their own. These small activities, do not try to be overprotective much. Try to celebrate anything that is happening in your locality or in your society. For example, it can be Diwali, it can be your birthday, anniversary, anything. That is really going to be helpful for the patients to uplift their mood. Also, it will be very much helpful to provide multiple distractions as well, so that they can control their negative emotional thoughts as much as possible. Now we are at the end of today's presentation, and in the next slide, I will be focusing upon only to the core areas where you surely need the psychological recommendations from any expert or psycho-oncologist. The first and the most important thing is managing body image. A psycho-oncologist is going to provide multiple cognitive behavioral modification strategy so that you can accept yourself the way you look now. Your new look, that is very important, and that's only you can understand. So it's very important for you to appreciate yourself the way you look. During the cancer treatment, our caregivers can also experience burnout because they're also human being, and it's very obvious because the course of the treatment is going to be very long here. So yes, a psychological counselor is going to teach you how to manage your own burnout as far as possible and as much as possible as well. Always remember, after the active cancer treatment, it's very important to adhere to follow-up or follow a proper exercise schedule, follow a proper psychological healthy routine and rehabilitation as well. As Dr. Nayak already explained that we have seen during the counseling session many quirks in our society. Our patients, sometimes by mistake, they will go to them, and later the prognosis is surely not going to be good. So it's very important here that we need to understand that a psychologist is going to be helpful for you to give you a clarity about what you need to do and why you need to do. It's really going to be helpful for you to improve your overall quality of life if you stay in touch with the psychological counselor and regular follow-up as well. Thank you, Aditi, and thank you all the participants.
Thank you, Jayatri, for this wonderful presentation, for explaining the importance of managing well-being through positive thinking and psychological counseling session during and post-cancer treatment so clearly.